I'm Dr. Mike Varshovsky, board-certified family medicine physician.
And I'm Dr. Donald Pettit, board-certified emergency medicine physician.
We're gonna settle the age-old debate. Let's get started.
Emergency medicine versus family medicine, which specialty is harder?
That looks like an E.
Oh,
That looks like an E.
I know you think it looks like an E, but it's actually an F, and I'm giving you guys a little credit by almost giving it an F. Okay, why is EM harder?
So we need to make decisions right away.
You mean like from the guidebook?
No, that's why they're called guidelines.
Oh, guidelines, okay.
Yeah.
So not the guidebook.
Exactly. I think FM is hard, but I think, you could say, let's send some tests and I'll see you in a month and see how you're feeling. I think you can go about it in a stepwise fashion. So.
Interesting. I was thinking EM is more stepwise fashion, because once you get the ABCs of trauma down, you're kind of chilling. We have charting, ER doesn't have charting.
What do you mean? We have charting.
I have never once read an ER note that I was impressed by.
Either have I, but we still have to chart. Who reads family medicine notes?
Other family medicine doctors.
But if you're the primary care doctor, who's reading your note? Yourself? Are you patting yourself on the shoulder?
Yeah, if you're being seen in a multidisciplinary practice, everyone reads the note. If I send a patient to cardiology, how's the cardiologist gonna know why the patient's coming in?
Well, clearly, if they have a heart, you're referring them to cardiology. Right?
Obviously, because a heart is representative of love, and that's what family medicine is. Love.
Next question. How many patients per hour do you treat?
Oh! But I feel like the acuity is different. I feel like you would see more.
Like if somebody's more sick, if I'm working in the critical care area of our ER, it'll be more like 3 patients an hour. But obviously if you're working in a fast track kind of treat and release area, it's possible to see more than that. How about you? 3 is like more of the intake,
the
primary visit?
rule is you're supposed to at minimum have 15-minute appointments. So technically you're supposed to see 4 patients max, but that doesn't take into consideration emergencies that happen in addition to it, or patients you might have to take care of virtually from like a call coming in between patients where you're kind of making a home visit or a telephone encounter. So that's why I added 1 extra one.
What is one skill med school didn't teach you?
Apparently Donald learned everything in school.
We learned a lot.
They didn't teach you to arrive early and stay late?
I think in medical school, they teach you to work as hard as you can and show up to your rotations, but I feel like in general, they don't teach you when your shift is over, it's actually not over. Patients will speak to you after your shift is up and you take home things with you. So I think it's important to translate
That's
that.
fair.
And I'm sad that you didn't learn spinal taps in school.
Do you know why I didn't?
Why?
Because of the Haemophilus influenzae vaccine. It reduced the rates so much of meningitis that we stopped seeing and requiring the skill to be learned. So maybe you could teach me later.
We'll do some brush
Can I
up,
practice on
CME.
you?
Sure.
You let me do a spinal tap on you?
Next question.
What's the best part of your job?
Saving lives. He's a walking Grey's Anatomy book.
There we go. The best part of my job is saving a life. There's no way I can describe how good it feels to work as a team and help somebody and pull them out of near death and put them right back to where they were. That's the best feeling in the world.
What do you consider saving a life?
A patient that would have died without intervention
That day.
that day.
I get why that's very rewarding. I rarely have that. I have the opposite, following the patients for a very long period of time. So while we're not usually saving lives imminently, we're prolonging people's lives, allowing them to decrease risk within their life. So it's a huge win because you could follow them throughout their life. And then when I said diversity, that doesn't just mean demographic diversity. That means diversity of cases, diversity of age groups. We see a 1-month-old or a 101-year-old. So we just have the entire scope of healthcare.
What is one trait that you believe is the most important to your specialty?
Okay, I didn't know that was a trait.
I think that's the ability to handle stress. Maybe I should have said resilience, going from one hard case to the second hard case, and relatability.
You're gonna see so many different cases, people having a variety of problems. People will experience the problems differently. So no 2 patients will present the same, even though their symptoms might be the same, but their experience of those symptoms will be different. If you can relate and shift the information to be able to land for your patient, I think you'll have better success.
What is one stereotype about your specialty that's actually true?
Oh yeah, because If you look at Glockenflocken's thing, he's the biker.
ER doctors are totally adrenaline junkies. If you talk to them for more than 10 seconds, they'll be like, "Oh yeah, I rock climbed to work, and then I biked a 10K during my lunch break." Too much punting.
Too much punting.
So you think that's true?
I think that it happens too often. I think you get family medicine doctors who either fell out of love with the field, perhaps are too busy and overwhelmed in the system, which happens very often. And as a result, whenever the case even gets mildly complex, pass it off to another specialist. So I don't believe that's the correct way to practice family medicine. I think you should treat as much as you are capable of, and we have a high capacity for treatment, especially in the day and age where we have such good information at our disposal.
What is one problem AI could solve for your specialty?
I didn't want to say notes. We are all about prevention. If we can create a vaccine to prevent you from getting cancer, wouldn't that be epic? Maybe AI can help with that.
I didn't think of it that way. I just thought, what can make,
You're like, what can make my life
what
easier?
can make our job easier, and I could take care of more patients.
Yeah, and I
and
thought
spend
about
more time with
helping my
patients.
actual patients.
Yeah. Well, no, this
Clearly,
would-
you could see where your head's at. He's trying to get off earlier to be an adrenaline junkie and hang out with the snakes.
This would help my patients too, because I could spend more time with my patients and less time on the computer.
Fair. People are going to call me a vaccine shill after that. Sorry, I want to prevent cancer.
After that, what is one low-tech tool you swear by?
A light? I mean, everything needs light.
He said
Everything
it.
needs light.
And Edison came up with this shit, right?
Oh,
Electrocardiogram?
Yeah, but how important is a light to look inside the
Super
nose,
important.
the ear, the mouth, the butt?
I do carry a pen light in my pocket when I'm at work.
Why don't you just use your phone light?
I think that's weird when patients see your phone
Oh
coming
yeah,
out.
because I say like, do you mind if I use my phone flashlight?
Yeah.
And I've never heard a patient say no.
I just think it's bad taste if you're doing like you said, if you're looking at somebody's genitals and you're like, do you mind if I use my phone light to take a look inside? Like, I feel like that's just
Okay, you're right.
It's just a weird.
Okay,
thing to
I
even ask a
succumb.
patient.
Stop bullying me.
So, but I
ER
do
doc.
like the light. EKGs, I think they're just simplistic, and I think they haven't been innovated in a long time because they do wonders for patients. We're able to see the electricity of their heart. We're able to see if there's an ischemic event or an arrhythmia.
what is your favorite procedure to perform?
Ingrown toenail. It sounds very satisfying.
Why'd I put dashes in between them?
Ingrown toenail. So I love cardioversion, especially awake cardioversion, obviously, but I always play music for my patients before I cardiovert them.
Well, first explain what cardioversion is.
Yeah, so cardioversion is when you give the patient a shock through the chest to restore their normal heart rhythm. And we put pads on their chest and we administer a shock through the machine and then restore them to a normal rhythm.
Why do you put music?
I like it because it relaxes patients.
Oh.
It's their body, their DJ.
Oh,
So-
their
So
body,
they get
their
to they get to pick what music
He
they
has
want
like
to
a
play.
catchphrase and everything.
Yeah.
Wow, okay. Oh wait, I didn't get
Yeah,
to talk about my favorite
about
procedure.
Your ingrown toenail.
Ingrown toenail. The bloodiest procedure I perform, and it's fun because it provides immediate relief. So like you do a toe block and you just cut out the nail, and it looks like it hurts so much, but it's actually not painful because the toe is numb. And it's cool to teach to residents because they're like, whoa, this looks like torture, and then the patient's really happy. And we don't
do that
actually
digital block,
play
yeah.
music.
You should play
We
some
don't have
music for
budget
that.
for that. When if I take out my phone, I feel like it's an ethical thing.
I use my phone for the Spotify.
Oh,
for
you
that.
use the phone for that, but not for looking at genitals.
Clear the boards.
Yikes.
What is the worst thing a patient has ever said to you?
Ooh.
Oh, you smell.
And I actually don't think I smelled, but that 5-year-old judged me really hard, and then like I didn't know what to do because I felt like I smelled, but I kind of knew I didn't. So I was gonna give her a sticker and everything. Then no sticker for her.
Maybe a scratch and sniff one.
Yeah, exactly. With my scent.
You don't care about me is probably the hardest thing I have to hear.
Where do you get that said to you? In the beginning, when you're asking them to discharge?
Usually,
What step of the process?
either patients who are suffering from either a mental health crisis or maybe somebody who's having a really hard chronic medical problem that we can't help them with acutely. It's really unfortunate because we do care about the patients. It's sometimes we can't help everyone. So
It says low odor.
What is the part of your job that makes you the most queasy?
So fingernail avulsions for
Oh,
me.
that would hurt so much.
Yes, anyone who's had their fingernail like pulled off or ripped off or broken and that gets
So what
me.
do you do when you walk in?
I mean,
just go like this?
No, just suck it up. Just
For me, it's gagging. If I'm doing anything and the patient starts gagging, I want to gag myself.
maybe it's like yawning. It's like contagious.
Yeah, but why is gagging contagious?
No idea.
Maybe like if
Maybe
one
like a
group,
noxious.
yeah, like one group ate something bad, so then your body's like, oh, I must have
Yeah,
eaten
exactly.
that bad.
Like our prehistoric response to
Interesting.
eating something or swallowing something.
It's tough.
Between family medicine and emergency medicine, which specialty is harder?
I honestly don't know.
Okay, FM it is. I was gonna wait to see what you put and then change it.
I think half of our answers were exactly the same, and I
Yeah.
think we go through a lot of the same things.
I think it's primary care, just different acuities. You're also playing detective. You're also doing it at a rapid pace. You're also under immense pressure in order to take care of lots of patients. You're in a healthcare system where people are worried about their bills. It's really the same but different. That's why I put EM, but it could also be FM because they're both amazing. And you're confused.
I don't know.
I think if I wasn't family med, I'm not gonna say I'm gonna go to emergency med just for this conversation, but I was gonna do surgery. But my third place was EM because like I thought I would do good under pressure, but I really missed that relationship aspect with patients. Like I thought if I would be so efficient, I would be too little in a room with the patient. I wanted to be more.
So that's the nice part about my job because I feel like when I do have the time to slow down and spend some more time with the patient, it really is.
Oh, so you can
meaningful to me.
actually, if you're efficient, you can spend more
Exactly.
time.
So I feel
thought
like
about it
part
the
of my
other way.
efficiency is being able to spend more time with the patient.
Well, watching Robbie and how good he is on the pit, I'm kind of jealous because he actually seems like he's chilling most of the time with his patients,
He does.
with the exception of episodes 12 and 13. But foreshadowing. Speaking of the pit, click here to watch an episode of what it's really like to be in the ER from one of the most accurate medical shows in the game. And as always, stay happy and healthy. And thank you to Dr. Pettit. You'll see him soon. Spoiler.